How's everybody doing out there? Hopefully very well. This video is about knee problems. So I'm 56 years old, almost 57. Never had a knee injury, never had any kind of surgery done on my knee or anything like that. Never had no torn tendons, cartilage or anything. So on December 18th, our team was playing in Manteca, California. It's BLD, Big League Dreams, the replica fields. So they have turf infields and have regular grass outfields. So my first at bat, the guy in front of me hit a single or a double. And then if he threw, my mindset was if he threw me an outside pitch or something I could handle to opposite field, that's where I was going. So we go first to third or second and third. So he threw me a high outside pitch. So I went right field line with it off the base of the wall. I was wearing, matter of fact, I'll grab him real quick. I was wearing these brand new turfs that I just bought. They're by Innova. And the bottoms on them are real gummy. So the reason why I got these is I really like these shoes and I like the Ultras. So I got these because they were GTX, which means they're made of Gore-Tex and they're waterproof, not water repellent. So I got them and I'm like, I'm going to use them the first time because it was cold out, so I knew the grass was going to be wet. So anyways, we batted first. Second batter, like I said, hit it off the right field wall. Going around first, I felt a little discomfort in my left knee because the things were gripping too much on the artificial turf. But then I kind of picked it up, when you feel something grabbing a little bit, you lift up your foot. So I was a little ginger going around first. Well, I was going to go to third because it was down the right field line. That guy was playing me in the gap, so he had just gotten the ball. And so I was banking to go to third, planted my foot on the inside of the bag. My foot stayed straight. I turned. And then I felt, like something went wrong, so something gave that shouldn't have given. And then so I limped into third. And I can even see it on the video of when I did it. And so I limped into third, and then guy singled, I limped home, and I could hear myself on the video telling Albert, who led off the game, I said, I think I'm going to have to change my shoes. I said, because these things are gripping too much. They were fine in the outfield. On regular grass, they're fine. But in the infield, they were way too grippy for that because they're brand new, and the knobbies on them are real gummy. So I think I played another inning on him, and I could even feel myself limping in the outfield. I just knew I did something. And so I changed my cleats out to my older Innovas that weren't waterproof, but they were worn down, so they weren't as gummy as these right there. And then those worked fine, but I still felt, I wrapped my knee a little bit, and I just didn't go as hard on it because I felt it was bad. So that was the first game. I think we played... It was either 5 or 6 games that day. It was 5 or 6 games that day. That was the first at bat in the first game. So against the 40s teams, we didn't have to play 5-man, but against the other, we were a 55s team, but we were playing in the 50s bracket. So the other 50s team, we had to play 5-man. So I had to play center field in the 5-man with a bum knee. So did the best it could. This was on December 18th. I knew I kind of hurt it. So made a doctor's appointment to go see my doctor. He did a couple little, pulls on it and stuff like that. And he says, I think you did something to it. He says, first of all, if you know anything about insurance companies, it's always, let's take an x-ray first, even though they know it's not any kind of bone injury. Let's take an x-ray first. So they took an x-ray. The x-ray showed that... So when I was born, and I'm a little bow-legged. So I knew that in a certain time in my life that was going to cause me problems because when you're bow-legged, it spaces out on the outside of your knee more than on the inside of your knee, and it clamps down on that meniscus. So, you know, we weren't the richest people when we were growing up, so really couldn't get it fixed. So I knew that it was going to be a problem down the line. So when I torqued it right there, that was the problem. I ended up, so he did the x-ray on it, then he said, yeah, we're going to do an MRI on it. So they did an MRI on it, they found out that it was a complex tear. If you don't know what a complex tear is, it's a tear from two different directions, and it's two separate tears in your meniscus. So a meniscus is shaped like a crescent or a horseshoe, and it's shaped just like this. And so I had a tear on one of the horns, and on the other horn I had another tear, and they were going two different ways. So of course, if anybody's had any problems, you know what the first thing they told me? Well, we can shoot it with cortisone. Well, I did a lot of research on it, and before I even knew something was, you know, what I knew was wrong, because I knew I did something to it, because I never had a knee problem. I knew it never felt like this, and I knew I did something. So I did a lot of video watching, a lot of reading, a lot of books, a lot of articles, and everything like that. And found out that they were going to tell me the first thing, yeah, we'll shoot it with cortisone. Well, right away, I knew I didn't want to shoot with cortisone. Cortisone, all it is a pain inhibitor, and it eats cartilage. It's going to end up degrading your joint. So if you do cortisone, you're on your way to a knee replacement, and that I don't want. This is my first time I've ever had anything happen to my knee, and I wasn't going to let this be, you know, I'm going under the night getting, you know, a partial knee replacement. So he referred me to the sports medicine doctor. So if I have Kaiser, so if you know anything about Kaiser, it takes them forever to get all this stuff done. So I'm about a month into this, and finally I go to the sports medicine doctor, and he goes, yeah, he says, he looks at the MRI, and he says, and they said I had a partial ACL tear, but I don't think I had a partial ACL tear, because it just didn't feel like a partial ACL tear. And anyways, if it was, it's already healed. There's nothing wrong with my ACL now. It even said on the report that it was intact. It didn't say anything about it. I think they mistook that for the MCL, because your MCL goes over your meniscus on the inside of your knee, the medial side, and mine was pinching down, so it looked like a thumb, because I could see it. When I went to this lady, she did an ultrasound on it, and you could see it. The meniscus was pushing out like this because it was clamping down, because the space in my joint, the outside was like this, the inside was like this. And that's a little drastic for what it looked like. It wasn't that far spaced. But anyways, it was pitching on the meniscus. That was causing me pain, and also two tears. And when it was pushing out, your MCL is the ligament goes right up the inside of your knee, and it stretches really tight. Well, they said it had a rainbow effect to my MCL, and they weren't for sure if it was torn, and it wasn't torn. It's just the meniscus was pushing out so hard on it that it was compacting those fibers right there and stretching it. So that was also causing me a little bit of pain and discomfort. So he said, well, what do you want to do? And I said, well, they told me cortisone, and I told him no. And he says, and even the sports medicine doctor said, yeah, that's a good call. He says, cortisone is just a Band-Aid. He says, then you're going to end up, you're on your way to a knee replacement. I said, exactly, I'm not doing that. And he says, I can prescribe you it's called an unloader brace. So that's what I'm going to show you now, is the unloader brace. So the unloader brace, you can get them a few different, mine was supposed to be just one side, this side right here. It was just supposed to have this side. It wasn't even supposed to have that side. So that's the one he prescribed for me. And what it does is it puts pressure on the outside of your knee and actually straightens your leg up. Your leg's like this. It actually straightens your leg up because it puts pressure on the outside of your knee. And when it puts pressure on the outside knee, remember the gap on the outside's wider than it is on the inside. So when it puts pressure, it closes this gap up and widens this gap out, so it evens it out. And it takes load, which is why it's called an unloader brace, off the inside of your meniscus. So he prescribed that. So when the guy came, so they actually had a guy come here and measure it and everything. This is only made for me. He has this instrument he puts over. He measures everything from your quad around your knee to right above your calf, and that's where this comes in. And they make it specifically for you. It took about a week to come in. This thing is phenomenal. So I put it on that day. The only thing that's uncomfortable with it is right here, the part that goes on the front of your shin right there. There's a lot of pressure that it puts on that right there. So it digs in a little bit, even though it's cushioned really good and everything. It kind of digs in right there. So I'm going to see if I can come up with something I can put in there, like maybe a gel pack or something like that, that'll help with that. But overall, the brace is fantastic. So this is the, let me put on my glasses here. So this is the thing you load it with right here. So it has numbers on the side here, and this tells you how much pressure you're putting on it. So it goes from 0, and I don't know what it goes up to. I'm up at 8 right now, which is pretty high considering I've only had it for a little over a week. I think just a week now, maybe not even a week. No, I got it on Tuesday. On Tuesday or Wednesday? Yeah, Tuesday. So it'll be a week. It'll be a week tomorrow. So, anyways, it starts out at 0 and it goes up in. You can go up in quarter increments. Just one click is a quarter increment. So I usually started out at 0 when I put it on, and then when I put it on, see that's at 0 right now. And then when I put it on, I tighten up the straps. And then I start adjusting it right there, and then this starts pushing. And it also comes with 2 different pads too. This is a thicker pad, and they're just Velcroed on. Thicker pad and a thinner pad. So I go with the thicker pad. I just changed out the thicker pad, so then I don't have to put it up at 8. I can put it at a lower number because there's more of a shim in there than this. This is twice as thick as this one is. So anyways, I wore it to work on Wednesday. Is it Wednesday? Wednesday or Thursday I worked at work, and he said you probably won't be able to wear it the full 8 hours because you're getting used to it and it's going to be uncomfortable. I wore it for 6 hours, and the only thing that got uncomfortable, like I said, was right here on my shin. And my problem is I didn't wear it. I wore it right up against my skin. I probably shouldn't have done that. So I've got leggings that I wear. They're the kind of compression, but they're kind of like Incrediwear, where they increase blood flow and stuff like that, and they keep everything nice and tight and nice and warm so you don't pull muscles and stuff like that. So they go from like my mid-calf all the way up to the top of my quad. So I should have worn that. So anyways, when I played last weekend, I wore those. And I wore this actually on the outside of my sweats because I wanted everybody to see it. Because people were asking me, hey, how's your knee doing and stuff like that. People that I knew were asking me how my knee was doing. I said, yeah, I can still feel it, but I said it is getting better, but it's just, it's a slow process at 56 years old. You're not 18 made of rubber anymore. So I wore this, and I noticed before I had the brace and I was running, I could really feel, even if I was barely jogging, I could really feel it on the turf. I could really feel the discomfort in my meniscus because turf is just like running on concrete. There's not much cushion there. It's a lot easier on natural grass and dirt because it gives a lot more. So I noticed when I wore the brace, I went out there to begin with, I started stretching and I was running around and stuff, and I'm like, and then he said, I don't even know if you're going to be able to run in this because it's pretty, as you can see, it's pretty good size. But it's actually pretty smooth. It's going to take a little while for you to get used to it. But as soon as you get it, I would start wearing it and getting used to it if you have to wear it in a game or something like that. It doesn't really slow you down that much, actually. I caught a couple balls that I know if I didn't have the brace on, I probably wouldn't have been, because I couldn't cut that well without the brace. With the brace, you can cut better. Not the breakneck, cut that I used to have, but it is better than not wearing one at all, and it protects your knee. So I wore it, and a lot of people were asking me about it and stuff, so I thought I'd make a video about it. Anyways, it's really lightweight. Even though it looks huge, it's really lightweight. It's even the straps are all numbered, so you know in what sequence to tighten them down. So it's a great brace. If you have insurance and it covers it, then you ain't got to worry about it. If not, they're super expensive because they're like I said, they're made just for you. So it's a one-off for you. So the guy has to come and measure it and everything like that. So it's going to be expensive. I've heard as much as $800. I don't know how much the original one cost, but I didn't pay nothing for it because my insurance covered it. But if you have good insurance, this would be something. If you have, a meniscus, or even they even have them for ACL and MCL. I think they even have them for that, and maybe a PCL. They even have braces for that. You might want to check on it. Mine is a Breg Custom. That's where I got mine. There's the name right there, Breg Custom. So that's my brace, but there's a lot of people that make them. I don't think Incrediware does, but there's a German company. I think it's called Baum or something like that, BAUEM or something like that. They make really nice leg sleeves with gel packs in them and stuff, and they also make one too. There's probably high dollar also, but this is what I wore, and like I said, the hinge joint is very smooth too. It doesn't catch or bind or anything like that. It's great. So this was my first thing towards my recovery. My second thing is, I told you I wasn't going to do cortisone. So I did a lot of research on PRP and stem cell injections, and also hyaluronic acid. So hyaluronic acid does real well, I heard, but it doesn't do as well as PRP, and it doesn't last as long as PRP and or stem cell. Stem cell is the most expensive. PRP is the next most expensive, and hyaluronic acid is the cheapest. So I was looking at PRP. Stem cell is, like I said, it's pretty high dollar. Sometimes you have to pay as much as $10,000 or $20,000 for an injection. Where PRP, depending on where you are in the country, it could be $650 a visit for a shot, or and I paid $1,200. It all depends on where the area is, and how high dollar area it is, and it could be as much as $1,500 a shot. So mine's going to be $1,200. And she's going to give me 3 shots. So if you do go to PRP, make sure it's a place that pulls 10 cc's, not 6 cc's. 6 cc's won't be enough platelets to spread around and shoot enough in there to get the healing process going. So my PRP is supposed to be tomorrow at 2 o'clock. 2 o'clock tomorrow. So I started wearing the unloader brace for just right now, and then to help also straighten out my leg a little bit, and then the PRP, and there's more research on it now, to where actually they're showing that the cartilage is regenerating, is regrowing, and there's also pretty good science in the work right now where they actually go in, they take a little bit of your meniscus and they send it to a lab and they grow it. And then you have a brand new meniscus, and they insert the new meniscus. So stuff is really, it's getting out of the dark ages now. And this stuff right here, so this is the stuff that Steph Curry did back in 2016 when he hurt his knee in the playoffs against Cleveland. And then all of a sudden he came back like 2 or 3 games later, and he looked like the same Steph Curry. Now, it's not going to work like that for everybody. And depending on your age, like Steph Curry's a lot younger than me, so it probably worked even better on him because he's younger. But this is a much better alternative than going under the knife, because once you go under the knife, you're never going to be the same as when you were before you went under the knife. And I don't know, at 56 years old, I really don't think, in my first, I've never had knee problems. I don't think the best alternative is go right for knee replacement. Mine would just be a partial knee replacement anyways, where they don't have to cut the ligaments. But still, there's something that has to be done before that. That's my last alternative. So, like I said, I'm going to do the PRP. So this will probably be the first video in probably at least 3 videos, because after you get the PRP, then they set up an appointment 6 weeks later to do an ultrasound and check your progress, see how it's healing. And then you can get 2, 3 different sessions, depending on if you're healing better. So it acts differently on different people, just like any kind of medication does, just like aspirin, or some people take Tylenol, some people need Excedrin, so on and so forth. So everybody needs a little bit different dosage and stuff. So I'm hoping it'll just be one injection. I think she's doing, one visit. It's not one injection. It's going to be 3 different injections, but it'll be one visit. So it's not $1,200 per injection, like 3 times that. It'll be $1,200 for the whole visit. And then plus my office visit was $250 to go get the ultrasound and the evaluation to see if it was even going to work. Nice thing about the doctor I went to, she even tells you whether it's going to work or whether she thinks it's going to work or not, because she's not going to waste your money or your time or her time if she doesn't think you're a good candidate for it to work. So make sure you find a good doctor that's just not after the money, that is after you getting better and you getting back on your feet and doing what you enjoy doing, which I enjoy playing softball, and that's what I want to keep doing. So I'll get her card and I'll show you the person I'm going to. And it's called Remedy Sports and Regenerative Medicine. Her name is Nancy E. Rolnik, MD. That's her right there. And she's in Walnut Creek, California. These people are all around the country. You just got to find a good one. Make sure you check like Yelp for the reviews and stuff like that to make sure they have good reviews. She has excellent reviews. And when I went to talk to her in my first visit, she's outstanding. She even has a website and everything like that. There's the website. Hopefully you guys can see that. But I'll see if my nephew can go ahead and put that on the bottom too, with the telephone number, her address, and everything like that, and all of her info and her web address. So she's a great lady. Really listens to you and everything like that. Always asking if you have questions. She's upfront about everything, about how she thinks this is going to work for you and everything like that. So if you're in the Northern California area, she's a good person to go to. If you're not from this area, like I said, just do your due diligence and try to find a good person to go to and that has good reviews. So like I said, this will be the first video out of at least 3, maybe 4 videos. I'll do one right after I got the shots, and then I'll do one probably an update as I go along, probably like 2 or 3 weeks in, and then 6 weeks when I get my reevaluation to see what how it's looking, and then whether I need another shot or whether she says it's looking really good right now and you don't need another shot. And then I'll also tell you how it's feeling, if I feel like it's getting better or if it's staying the same or possibly getting worse. So anyways, thanks for listening, and see you soon.